I will react any severed limbs, just don't misplay them. After a long day helping patients in the emergency room, Prayer is prepping dinner when her knife slips and neatly severs her finger. Fortunately, being in ER doctor, she knows exactly what to do. First, she cleaned the wound with a wet paper towel and bandaged her finger, careful not to rub the wound too tightly. To manage the pain, she knows not to take ibuprofen, which would prevent the wound from clotting, and instead opts for acetaminophen. Then she rises off the severed finger, wraps it in a clean moist towel, and pushes in a cooler while avoiding direct contact with ice. Finally, she rushes to the hospital, where luckily a skilled hand surgeon is on staff. Thanks to the clean cut and prayer rapid response, the surgeons can get to work. They set the pawns and fix them in place with wires. Before repairing the tendons, nerves, blood vessels, and finally the skin. The entire incident is finished in about 8 hours. And after a few months of occupational therapy, Prayer Hands is back in action. This is the ideal outcome for reacting a body part. Unfortunately, it's also incredibly unlikely. And not just because most people aren't as prepared as Prayer. In reality, there are countless complications that come up with more assistance. First, there's the accident. Unlike prior clean cut, most traumatic amputations occur in car crash or industrial accidents. That cause extensive uneven tissue damage and dirty the wound in a way that prevents reattachment. Plus, more than half of all limb amputations in the United States are due to disease. A limbs removed for medical reasons obviously aren't safe to retouch. Then there's preserving the limb. When a body part is severed, its blood circulation is cut off, stopping the inflow of oxygen and other nutrients. Surprisingly, severed tissues can survive for a few hours without these resources, and keeping them could further slow the rate of tissue death. Generally, giving surgeons a 6 to 12 hours window for reattachment. But once the tissues die, reconnecting them won't bring them back to life. The tight timeline is especially challenging for surgeons. Due to the tissues we are already mentioned, reattachment operations are fairly uncommon. So most hospitals don't have the tools and expertise required to tackle these time-sensitive procedures, and even if they do, nerve repair is extremely tricky.